Welcome back to this week's episode of the Caregivers Podcast. I'm your host, Dr. Mark Ropeleski. You can call me Dr. Mark. In today's conversation, we're looking at what estrangement becomes when time is running out, how abuse, neglect, and old family roles complicate caregiving, and how adult children and siblings can make decisions they can live with later. It's one thing to keep the distance from a parent when life is relatively stable, but it's another situation when that parent becomes sick, dependent, and close to death. Then the questions get harder. What do we owe? What if the parent was harmful? Can you help without reopening the relationship and the wounds? And what happens when estranged siblings are suddenly forced to make decisions together about a parent they may each remember very differently? Our guest today is Dr. Joshua Coleman, a clinical psychologist and author of The Rules of Estrangement, Why Adult Children Cut Ties and How to Heal That Conflict. His work on family estrangement has also reached a broad audience through major platforms, including Oprah and the Mel Robbins podcast. Dr. Coleman, welcome to the Caregivers Podcast. And before we begin, please subscribe to the Caregivers Podcast on Apple Podcasts, Spotify, or wherever you listen. It's free, it takes just a second, and it's the best way to support the show. Dr. Joshua Coleman, welcome to the Caregivers Podcast. We're so happy you're here joining us today.
Thank you for having me. Glad to be here.
So in the tradition of the podcast, I love to jump right into things and start with a really important question. And that is, before we delve into and bring this to the arena of caregiving, how do you define family estrangement in today's terms?
Yeah, and different people define it different ways. I think of estrangement as a formal cutoff. You know, when an adult child says to a parent, I'm going no contact with you, or they just stop responding to them, or they move and don't tell the parent where, they cut them off from all forms of social media. So to me, it's a pretty hard break in the relationship. Now, for some, it may be the parent maybe gets a Mother's Day card or something, but otherwise, the adult child is completely out of contact. So to me, it's a pretty serious rent in the relationship.
So what tells you that a family relationship is no longer just conflict or distance, but sort of entrenched estrangement?
Well, most of the time, it's the parent who's reaching out to me, and they do so in response to the fact that their child has stopped responding to them, or they've written them a letter saying, you need to respect my boundaries. I don't want you in my life anymore, the lives of my children. You're toxic, you're emotionally immature. Please respect my boundaries, don't contact me. So usually the evidence is fairly straightforward. Now, in some cases, a minority of the adult child might just completely stop responding at all, and the parent doesn't know why, and all their entreaties toward contact get ignored. But most of the time, there's some kind of a communication that lets the parent know that an estrangement is going on.
I think it's really important for our listeners to also understand, and perhaps you can define this a little bit further, but this is not usually just a single one-off event, but this is a process that has a timeline to it. Can you tell us a little bit more about how these are categorized?
Well, yeah, I mean, there are, I'd say, 5 different pathways to estrangement. And one of the things I want to emphasize is that if you just read the news or social media, you would assume that it's only abusive parents who are getting cut off, because every day there's some new first-person essay or memoir coming out, like Jenny McCurdy's book, I'm Glad My Mother Died, or other books that talk about kind of the values and virtues of going no contact. And those are typically from parents who are truly abusive or abjectly neglectful. But that doesn't constitute, I would say, even the majority of parents who become estranged. Often it's because the parents divorced, either when the children were young or the children are grown, and either one parent poisons the child against the other parent, or the parent remarries and the adult child doesn't like who the parent remarried, or the person that the parent remarried doesn't like the child, or the adult child allies more with one parent, even if the parents are doing a good job as divorced parents, kind of navigating the conflict and the disruption in the marriage. So divorce is a really big predictor. Like in my survey of 1,600 estranged parents, 70% of them were divorced. So we know that divorce is a huge cause. Mental illness in the parents, certainly, but also mental illness or addictions in the adult child, the role of therapy or therapists or other caregivers who say that estrangement's in your best interest, or diagnosing the parent whom they've never met, normal separation, individuation. So it kind of depends on the nature of the estrangement, whether it's sort of a gradual straw that broke the camel's back, kind of a death by 1,000 cuts, which is not uncommon, or it's more due. Well, the other thing I didn't mention was politics, which are also a common pathway to estrangement. So sometimes that's more sudden. Oh, you voted for Trump, so I can't have you in my life, or something else that's more sudden. Or my wife or husband doesn't like you, and they're basically making me choose between them and you, and that can also be more abrupt.
So obviously when a parent then becomes sick, frail, dependent, and close to death, I mean, how does that change the emotional reality of estrangement when that starts looming?
I mean, sometimes it does and sometimes it doesn't. For some adult children, it may cause them to reach back out to the parent, to heal the distance, to be willing to have some kind of a relationship with a parent, both because they might have felt guilty about being estranged in the first place, or just don't want the parent to die, with that kind of heartbreak in their hearts and minds. But for others, it doesn't really seem to move the needle at all. I don't know if you saw the first Oprah interview, but there was a hospice nurse who talked about how sometimes, a dying parent will want her to give a letter or encourage that person to reach out to the dying parent. And, and her position was, well, I don't want anybody to feel guilty about not doing that. And I felt like, well, actually, that's an appropriate place to feel guilt. I think if your parent's dying, it's reasonable time to kind of put aside some of your own feelings or objections. Now, obviously, if your parent throughout your life was incredibly abusive and neglectful, and, the things that you've have really hurt you or damaged you have been lifelong, I could imagine why somebody might not feel like they sort of owe their parent anything. There are certain experiences in childhood that in some ways do cancel out some of those feelings of obligation. But in the majority of cases, I don't think that constitutes the majority of cases. And it is my wish that people, would grant a parent a dying wish. And sometimes a dying wish is really to make amends or to say that they're sorry. I mean, I don't know if you saw Bruce Springsteen's movie, but there was a great scene in it where the dad, it's kind of toward the end of the dad's life. I mean, his dad wanted to apologize to him for how abusive he was when he was younger, because his dad was an alcoholic and he was abusive. And, Springsteen said to him something like, well, you were doing the best that you could. The dad said, yeah, but it was still really wrong. I mean, I think sometimes the dying wish of the parent is actually to make amends. And I think that should be something we as caregivers should be supporting, not challenging.
I guess as long as we approach it with radical acceptance, and you talk about that in your book, and it's an important element of how you handle these relationships in your role and with the advice that you provide. So maybe it's important to get that out right now, because I think approaching that end-of-life encounter is important in terms of how each side approaches it, but radical acceptance is really foundational. So why don't we get that out to the open?
Yeah. Yes, radical acceptance is, it's just an important orientation towards happiness in general. And I think the first person to coin the term was, oh God, am I forgetting her name?
Tara Brach?
No, she made it famous, but is actually the founder of dialectical behavior therapy, whose name I'm forgetting for some reason. But radical acceptance has its roots in Buddhism, and that is the idea that pain plus struggle equals suffering. The more that we fight reality, the more we're going to suffer, because we can't really do anything about it, and we're just kind of pushing ourselves towards some end that can never be realized. So for parents, whose adult children, whether it's end of life or at some other point, don't seem open to reconciliation, radical acceptance, if they've tried everything, is really an important orientation, because Otherwise, they're just constantly fighting against something that they can't change, or they have a kind of a case of maladaptive hope where they are really struggling to, they feel like they can't live their lives until their child comes back. And if you're the adult child and you've had a really abusive or difficult parent, or a parent that you don't feel like you can reconcile with, radically accepting that the parent may not change or may not be able to change, or that this is kind of as good as it's going to get, can also be better for your mental health than constantly struggling against those feelings and wishing it were otherwise and being mad at the parent that they didn't give you what you wanted or needed or that kind of thing.
I think that points to the fact that it does come from both sides, and the parent needs to approach an attempt at reconciliation with a certain mindset, as does a child, and perhaps putting all of that hope aside for immediate change, because it's probably not going to happen, but it could still be fuel with acceptance for compassion in those final days or months.
Yeah.
So do adult children... Sorry, go ahead.
No, I was just going to agree with you, right?
Do adult children owe their parents care simply because they gave them life, or does the quality of the relationship matter?
It's an important question. It depends what care means. Does a adult child whose parent was abusive and neglectful to them throughout their lives, are they obligated to bring that parent into their home and take care of them just because they're sick or fading? In some cultures, the answer would be yes. But I'm an American, and I don't think that is the case, that a parent who's been abusive or neglectful throughout a child's life, that the child is obligated to take care of them. But I do think that there's some obligation to at least express some degree of concern. I think that in the same way that adult children who are estranging themselves are doing the best that they can in terms of having having a life without their parent that they feel like they need to do for their own happiness and mental health. I think parents do the best that they can when they're raising their children. I mean, even abusive parents, nobody wakes up in the morning and thinks, I'm going to go abuse my parents, or my children rather, I'm going to go give them a miserable life. So, I think everybody deserves compassion, but it's not necessarily realistic to expect that the victims of that abuse are going to feel compassionate. But then we get into the topic of what constitutes abuse. And I think as a culture and as a society, we're very confused about that. I think a lot of parents are getting estranged today for behaviors that their adult children are labeling as abusive. That's just kind of normal conflict or disappointment or character flaws or mistakes and the like. And so, to visit upon a parent, the nightmare of estrangement, because of something that should be greeted with a bit more empathy or resilience, I think is a problem in our current society.
Well, I think that probably, big T trauma and little T trauma are important to distinguish and big V victim and little V victim. If
right,
victim is going to be used as a term in this case, because it's a slippery slope, and I think we're seeing it, and it probably fuels some of that toxic individuation that we're now seeing that enters the equation, which may just fuel estrangement even more.
Yeah.
When the parent was emotionally neglectful or absent or abusive or unsafe, how does that change what care, if any, an adult child should be responsible for?
I mean, it's hard to have this tell you what I think in terms of being our American state of individualism. So I'll answer this kind of the way I think about it broadly, in a way that I don't think finds a lot of resonance in American. In our culture, we have like the highest rates of individualism than any other society in the world. And in an individualistic culture, your primary orientation is toward your own happiness, your own identity, your psychological health, your boundaries, etc. And the idea that you owe your parents something is completely secondary or even tertiary to those aspirations. So from my perspective, somebody who gave somebody birth, if the person wouldn't be in this world or wouldn't have their own children, I do think that there are obligations to that parent. Are there obligations to them sort of forever or no matter what, or do they have to accept all of the terms of that the parent wants or be as available to them? No, not at all. But I do think that they're obligated to at least give the parent an audience, the availability to repair, to understand the parent, to be forgiving towards the things that they were, even abusive about at some point. But in order to be able to forgive somebody or tolerate a relationship where there was abuse, you have to be completely clear that you didn't deserve it in the first place. And that's a big reach for most people.
It seems once again like it's just that sort of dichotomy between sort of establishing self-compassionate boundaries, which allow you to caregive for someone where you have to acknowledge that maybe they didn't rise to the occasion like you would have hoped as a parent, versus ideologically inspired boundaries, which are just immobile and entrenched and make no room and probably fuel more suffering.
Yeah, absolutely. Yeah, I think that we're very confused about the notion even of boundaries. And again, I think it goes to being in an individualistic culture where our own happiness is so prioritized. Because in other cultures where individualism isn't as much the orientation, where group membership is much more the orientation, where sociality is more the definition of happiness, those cultures generally are happier and doing better than in societies like ours, where we have record high rates of mental illness. And it's in part because we're all just sort of so preoccupied with our own boundaries and personal happiness and mental health and personal growth that we're not actually attending to the people that could either both who gave us life, but also who could connect with us and give us other sources of value and meaning and purpose and identity. So, for example, for a large percentage of adult children, when they cut off contact with the parent, they also cut off access to the grandchildren. And these are often grandparents who are very loving and involved. And the narrative is often, well, if it's not good for me, it's not good for my kids. And yeah, if the grandparents really, every time they come over, they're out of control and they're screaming at everybody and humiliating them and communicating terribly, then it probably isn't good for anybody. But there's plenty of grandparents who are excellent as grandparents, and there's conflict between the parent and adult child, as there not infrequently is. And this idea that if it doesn't make the parent happy, it's not going to make their kids happy, I just think it's a faulty idea. And I think it's just also removing one more foundational layer of identity and purpose and support from those grandchildren that they could have otherwise, because grandparents can provide a whole lot of value, even if there's conflict and dissonance in the relationship between the parent and the adult child.
There's something special about that next generational love that you feel as a child from a grandparent, which is almost intangible, but it's just so felt.
It is intangible. I've been thinking about that a lot myself, that there's kind of a quality of shared innocence, and it's kind of a role where not a lot is demanded of either. The goal of the grandparent is just to spend time with the grandchild and take pleasure in them. And the goal of the grandchild is just take pleasure in being a child. And there's a shared innocence and vulnerability there that, when we're parents raising our children, we can participate in that some of the time, but we also have to get our kids dressed into school and make sure they do their homework and clean their rooms. There's a lot of it that's just more of a headache than a pleasure. But when you're a grandparent, it's ideally, at least it can be a more purely pleasurable enterprise for both parties.
Yeah, I think it was Arthur Brooks who's recently mentioned that his love of his grandchildren, the fun times he has with them and getting them fired up, telling jokes, making them giggle, and that's as good as it gets.
Yeah, absolutely. I totally agree.
So can an adult child help make sure a parent is cared for without actually reopening the relationship emotionally?
I think that's the aspiration of a lot of adult children. So I've worked with some who were either estranged or, could be estranged or in conflict with a parent. And they say, look, I don't want to revisit the past. I don't want to go through that or litigate every complaint that you made. Let's just kind of go forward. And that's often the wish of the parents as well. So it really depends on the individual. For some people, they just really need to feel heard and understood by the parent in terms of the ways that they felt hurt or traumatized or neglected or abused in order for there to be any way to go forward. But that's not true for everybody. It's probably true for the majority, I would say. But not in other cultures. I mean, I think we have to keep kind of circling back to, well, there's a lot of other cultures where parents are, really abusive or difficult or neglectful or whatever, and the kids, adult children, find a way to be in contact with them. But it's partially because families as a system are viewed in a much more integrated way. I have a friend who's Indian, South Asian, and she said, in India, we don't have this notion of extended family. It's just family. And I think that changes things too. I mean, if you cut out your parent, typically it's a cataclysmic event in the family system, and there's downstream effects where other people are now going to be cut off, cousins are going to be cut off, et cetera. So in other cultures, they just sort of accept it. Now, is that good? No, of course, it's not good that a parent who is abusive is not being held to task, but we're a little naive as a culture in terms of all the consequences of estrangement to the rest of the family system that follows from that.
So what are adult children truly trying to resolve inside of themselves when they step into the role of caregiving for a parent who hurt them along the way?
Well, it's a challenge because they have to have the capacity to forgive the parent and perhaps be giving to the parent in ways that the parent was never given to them. So I want to highlight that that's not some easy task. And while I can sort of wish from 20,000 feet above that everybody could do that, I think it's probably really hard to do that, particularly if the parent was cruel or neglectful or really damaged you as a person. I mean, it would take a fairly healthy, psychologically healthy person to be able to put aside those feelings of grievance and hurt, to be able to take care of the parent. But some people do manage to do it.
So in your studies and experience, can caregiving ever soften a parent or repair something in the relationship? Or is that usually a fantasy that adult children carry with them into caregiving?
No, I think for some it really can. And I think as parents get older, they may become more reflective or just softer or less defensive. And if there was a period of estrangement, it may have woken them up in some ways where they can now feel like, oh, gee, I really wasn't taking something seriously that I really needed to take seriously in terms of how I was interacting with my child. So I think that for some, it really can soften them and get them to look at themselves differently and how they treated their child differently.
Seems like that first conversation as that re-engagement begins is probably so important just to sort of establish some terms of reference. What are the most important ground rules that you've witnessed that you might advise individuals who are contemplating breaking that barrier and no longer being estranged, but rather trying to unite again, especially as caregiving calls?
I mean, ideally, the parent's taking the lead in terms of making amends. I mean, in general, that's my recommendation and my belief because, as parents, I do think the buck stops with us. And while I think we as a society or other people can feel compassion for a parent's mistakes, I don't think it's ever appropriate for the parent to just say, oh, I did the best I could, so you should forgive me. I think parents have to actually put some work and time and effort into taking responsibility and showing empathy and compassion for the ways that their mistakes or abuses or whatever it was negatively impacted their child. So I think if a parent is able to do that, I think it certainly would free up that potentially caregiving adult child to feel more open to do it and more receptive to the idea of doing it. But let's say that they can't or they won't, then the adult child, I guess, has to decide whether they need to have that tough conversation with the parent first. Some adult children might feel like, well, I'm going to be more involved in taking care of my parent, but first they need to hear for the first time all the ways that I felt really let down or hurt or abused by them, because I can't do this unless they hear it. And I think if that's the case, then you want to be clear about why you're saying it, that you're not raising it to just shame or abuse or hurt your parent, that you're saying it in order to be closer, to have them understand something important about you. That if there's something positive about the parent that you got from them, to start with that, just to make it clear that you're not raising it to hurt and shame and humiliate them. And then talk about it. And ideally to talk about what your complaints are, not from a perspective of being a character flaw in the parent, but really how their behavior impacted you. So rather than saying you were selfish, you were mean, you were cruel, when you did X, I felt Y, that kind of thing.
It seems like those important conversations may actually pay off in that they enable the caregiver to actually caregive meaningfully within a boundary that's compassionate and that's beneficial for both in terms of the repair process.
Yeah, absolutely.
What does a healthy caregiving boundary look like with a parent who's been harmful? I think a lot of individuals now hear, I got to set boundaries, but there's boundaries and then there's healthy boundaries. And if we're committed to caregiving and providing some, meaningful tools for our listeners, they have to understand boundaries. So what does a healthy boundary look like?
I mean, boundaries in general should be set with a certain degree of gentleness, because the person who's receiving the boundaries in general could feel humiliated by them or shamed by them or reproached or rejected. Because a boundary, usually if we're expressing a boundary, there's a complaint in it. We don't usually express a boundary unless there's an underlying complaint that necessitates the boundary. So ideally putting it in language that sounds kind of minimally rejecting or offensive or, that kind of thing. Being clear about what you're willing to do and what you're not willing to do. Okay, I'm willing to come over once a week and do this, but I'm not available for phone calls during the week, or I'm only available for 2 phone calls during the week. I can come for an hour. I can't come for 3 hours. I am not able to just do overnights with you. I can bring the grandchildren over once a month. Whatever it is, kind of know your limits, and be responsive to those, because if you don't, then you might just feel too resentful to do anything. So you're better off coming in with an excess of boundaries if it's just the only way you can give to the parents something that that they need and you want to give to them, than coming in with too much ambition in terms of trying to make them happy in ways that's just going to burn you out if they're not responsive.
What I hear and what you're saying is really that as caregivers re-entering, there is a place to establish your personal rationale for being there and what will allow you to maintain your personal health while re-engaging in a caregiving role for someone where that relationship has been strained.
Absolutely.
I mean, how do you know when caregiving for a parent is actually pulling you back, though, into that same role that caused the estrangement in the first place? Are there warning signs that individuals report or that we should understand?
I mean, I don't think anybody's going to be very naive about that, because I think somebody who was once estranged is probably pretty aware of the kind of things that bother them. So I think, I think the people who are the most in danger are those who are conflict avoidant and not assertive. And a certain percentage of estrangements happen because of that. So being able to be very verbal, that's why I say it's better to err on the side of being kind of too boundaried initially rather than being too expansive in your boundaries and then having to pull way back, because that'll feel more rejecting to the person than if you kind of come in with fairly clear ideas about what you're willing to do and not willing to do. But yeah, if you're starting to find yourself feeling really resentful, that's probably a sign either that you've committed too much or you're doing too much, or the person's behavior, the care recipient's behavior is triggering something in you that has to get addressed by you, either in therapy or with them directly.
And always remembering to identify those body signals that tell you that the stress is mounting, and if you haven't felt them in the while, they certainly may reactivate then.
Yeah, absolutely.
So let's change gears a little bit now. Let's talk about siblings. When estranged siblings are suddenly forced to make joint caregiving decisions for an elderly parent, what does that sort of pressure tend to expose or intensify between them?
Yeah, well, there's so many different dynamics that can happen. It's not infrequent that daughters, if there's only a daughter in the household or in the family, that there's sort of a greater expectation, not fairly to the daughter, but that she's going to. Daughters probably in general are more likely to have already stepped in or be involved in ways. And that expectation may persist once that parent is starting to, to fail. But it can also, whether regardless of gender, it can kind of trigger long-standing, simmering sibling conflict, where the person who's preferred, the sibling who kind of has done the best in life, may not. It kind of depends on the family and the individual, where some people may just feel comfortable stepping in and taking the lead. Others may feel kind of sidelined in doing that. Another worry is commonly, is that sibling who's much more involved going to trick mom or dad into changing the will so it benefits them. That's a really common source of conflict. I think it's also if the parent's kind of nearing death, for people who haven't really gotten enough from a parent, it's kind of a sad reminder that they're never going to get that which they may have hoped to receive from that parent while they were alive. So that can bring up feelings of sadness and regret, but also anger at the siblings who were favored or who did get more or continue to get more. So it can be a real hotbed of conflict depending on how the siblings navigate it. I mean, I moved my parents out here when they were my mom was in her mid-80s, my dad was in his early 90s, and fortunately, my brothers were back in Ohio. I'm in the Bay Area, and it all worked out fine because the deal was they were going to move them out here, and then they didn't live with me, but we set up a assisted living, and I would have to have primary responsibility. And that was kind of the trade-off. They packed them up, they moved them out, but our communication was such that it was fine. But in many of the families I work with, that's all one big hotbed of furball of mess between the siblings because of all those issues that I was just naming.
You can imagine if there's estrangement among siblings who are also then mutually amongst themselves estranged from the parent, it really creates a difficult situation where lots of important conversations need to happen with a certain degree of openness and acceptance of the past while just trying to manage the present.
Yeah, and many don't, and many parents die without ever reconciling with their children or with seeing that their children are estranged, and so it's sort of a tragedy for everybody.
So when estranged siblings have to make joint decisions and share responsibility, like what has to be in place for that to work at all?
Well, if the siblings are estranged, they're probably not going to be able to make joint decisions because they're not willing to communicate with each other. So that's why it's really important for parents to have a good, solid estate plan because they have to accept that they may not be able to navigate and make joint decisions once they're gone, and the parent's going to have to make their decisions in anticipation of that. They can't assume that, I'm dying, and so therefore my kids are going to, come together. No, in all likelihood, they won't come together.
Have you seen in your practice successful situations where changes in a parent's health has managed to bring siblings together, and with dedication, they've been able to make some serious steps forward?
Some, but I would say it's the exception, not the rule. I'd say the rule is more people are estranged when the parent is dying, then they're likely to remain estranged, or for it to even the death to even exacerbate it, because not infrequently parents, against my advice, will cut out an estranged child from a will, and then that can just worsen the relationship between the siblings once the parent's passed.
When time is running out, how do progressive chronic illness, dementia, or even a terminal diagnosis start putting pressure on the estrangement and the reconciliation that an adult child may have needed?
Yeah, for some, it's sort of enough of a reason to reconcile with the parent. A lot of adult children who are estranged, in the back of their minds, they're assuming that one day they will reconcile with the parent. And the research in general shows that around 80% of adult children who are estranged eventually do reconcile with mom, and around 70% eventually reconcile with dad. So for a lot of these adult children who are estranged, it's not necessarily a permanent decision in their mind. And I've worked with a few anyway, who parent died suddenly and they were estranged, and they felt really guilty and sad about it, that they put their parent through that and now didn't have the opportunity to repair. But for some, when their parent is dying, it becomes kind of a realization that they're never going to be able to come back to that parent, and it causes them to do some kind of a rapprochement for that reason.
I could see, though, how the terminality of diagnosis, though, can start actually putting pressure on what was afforded to the individual by the estrangement. And
That's true.
What served as a coping mechanism suddenly is under stress, and that could have a challenging effect on a child who's facing a dying parent and or a parent who with progressive disease. Can you comment on that?
No, I think you're right. I think for some, it may bring them to the bedside of their parent. For others, it's just they just can't. And I don't think it's because they're mean or selfish. I think they just feel like they either feel too hurt by the parent, or that they don't know any other way to be around the parent and not sacrifice some huge part of themselves. And so they decide to not visit the parent, or not make any kind of amends with the parent, or allow any kind of amends to be made from the parent, because they just feel like the cost to them psychologically is too high.
Does grief and guilt sometimes complement? Does grief and guilt sometimes come back posthumously after a parent passes? And do you have a certain number of clients who seek out your advice after a parent has died, when they weren't able to establish some sort of rapprochement because they stuck to their guns and dug their heels in and paid lip service to the mechanisms that help them cope over time, but then suddenly, once a parent's gone, that mechanism implodes?
Yeah, absolutely. I think that, I can't say I've worked with a ton of those individuals, but I've certainly worked with some, and I've heard from other colleagues as well that people who've been estranged, not everybody, but a certain percentage of them do feel some feeling of guilt and regret, particularly those who had it in the back of their mind that they would eventually reconcile. They may not have known when, but it wasn't in their mind that this was going to be a permanent thing. And then the parent dies more suddenly, or they contract some kind of a fatal illness, then they die in a very short period of time, and they just haven't had time to really work through the feelings that would have allowed them to have a relationship with a parent. So they're kind of left with the guilt, the grief, and the shame. I think the majority of adult children whose parents die still feel some degree of guilt and sadness, but also guilt, shame, and regret.
How do you cope with that moving forward? Is it just time-based, or are there steps one needs to do or go through to sort of embrace that and the reality that it is, and then start taking steps forward? It must be really strategic, and if you're going to be successful at that.
Yeah, I think it's the way that you're in dialogue with yourself, that you'd have to remind yourself that you're doing it, however hurtful it was to the parent. Your intention wasn't to hurt the parent or to wound them. It was really to protect yourself from a relationship that you felt was really harmful to you, and to kind of remind yourself of that, and to be in a position of self-forgiveness and self-compassion for making a decision that was hard on your parent ultimately.
So I guess when an estranged parent is close to the end of life, does that create, in your experience, a real opening for repair, or can it actually create pressure to reconcile that isn't actually always healthy?
I mean, I think it can certainly create an opening for repair. It can also create pressure, whether it's healthy or unhealthy. I don't know that anybody would be particularly damaged if a parent's dying and they give them an opportunity um, to make amends or to have a conversation or to say goodbye. I don't know that that would be really bad for anybody to do. I could see somebody arguing, well, it's just more of me taking care of them and being parentified and, you know, being codependent, but I just don't think it's a serious enough reason not to do it.
Yeah, I tend to agree with that in the setting of, the radical honesty of the moment and the reaching out. It may actually bring forward a little bit of peace as well
Yeah,
if it's given the
exactly.
space.
Yeah, often tell people, make the decision whether to reconcile or not, or to visit a dying parent in mind of how you think you'll feel, 1 year, 2 year, 10 years after they're gone. Because sometimes our immediate feelings aren't a great guide, but if we can kind of project ourselves into the future, sometimes that can give us better guidance.
So if an adult child chooses not to care or to reconcile with a dying parent, how can they actually make that decision in a way they can live with later on?
Yeah, I think again, it comes back to self-compassion and being in dialogue with yourself. Be very clear about what your reasoning was. Um, making, I don't think anybody should cut off a parent unless they've given that parent kind of done due diligence with them in terms of giving them the opportunity to change or make amends or repair. And that often means being willing to do family therapy, to have a conversation with the parent that the parent can actually hear, to not just come in blaming them or yelling at them or telling them, diagnosing them or whatever. So I think that there is an obligation, I believe, that adult children have to the parent to give them some opportunity for repair. But I also think in a more self-interested way that gives that adult child more freedom from feeling guilt if the parent really isn't able or willing to change or modify their behavior in a way that feels workable to the adult child. Because then they can say to themselves, well, I really gave them every opportunity I could. So it's not like I did this out of pure impulse or selfishness. And it's regrettable that they couldn't respond in a more sensitive way. But I felt like it was a binary. It was either their mental health or mine, and I had to choose mine, I'll live with that.
I really like that idea of the pay forward returns, the conversation you have moving forward with yourself when you recognize that, well, I came to the bedside and I gave them a chance. And if they were not capable, and, we know well about narcissistic personalities and other important terms which are very popular these days, and how those individuals may not change, and they may not change on their deathbed
Right.
either.
Right.
But at least your closure comes from having been present,
Yeah,
facilitated a conversation.
you've kind of earned your way out of it, in the same way that I think people with children who are going to divorce really need to earn their way out of the marriage because of the consequences to children can be so dire and grave. Also think estrangement is similar, that adult children have to earn their way out. But most of my methodology is around getting the parents to do the hard work of making amends and taking responsibility and showing vulnerability and compassion for the adult child's, including their decision to estrange.
You bring a wealth of experience, and certainly your book, The Rules of Engagement, The Rules of Estrangement, sorry.
Everybody does that, Mark. You're not alone.
Yeah, that's funny. I mean, I actually love the title because I think it's just brilliant. But that's funny. But it packs a wealth of knowledge, and I like its readability and its concisement. And you bring so much experience to the table, and at a time where caregivers are in crisis, and it's not in America, it's not in Canada where we are, it's everywhere. I'm sure the numbers are pushing, 80 million caregivers in in North America and the same across the world in different cultures and in different jurisdictions. And it's a real issue these days that everybody's contending with. If you had some parting words for our listeners.
Well, I just wanted to speak to that. I think that's all true, but I think there are other societies that do a much better job. I think that in the United States, both when we're raising our children and when they're young, and also when our parents are older, there's very little state support around helping either the adult children with the parent or helping the younger parents with their children. In other societies, particularly North European societies, they do a really good job of that. They pay higher taxes, but they actually have higher rates of happiness and mental health. In part because they do that. So there's relief from the caregivers because it's not all on them in the way that it is here. So, so I guess my parting words for if you're the adult child and you have a parent who's dying and you're either estranged, you've had a difficult relationship, it's really to kind of do due diligence in part. So you can, if you do decide to stay estranged, you can do it with a greater degree of serenity and psychological resolution. And if you're the parent, to know that your child may need something from you that you still haven't yet given them. That's an expression of regret or amends or compassion. That typically, if adult children have complaints about their parents, it's important to sort of think that there's a good reason that they have them or even need the distance, and so to approach them with self-reflection and responsibility. Those are really the key ingredients towards any potential reconciliation.
I think those moments are truly just that. They're moments to make some really important choices when it comes to reconciliation. And as you point out so aptly, it doesn't change the past. It doesn't change the trajectory of events that led to estrangement. But in that moment, just, again, radical acceptance from both sides that it happened, but something can be let go in the moment and something can be felt in the moment. Maybe the best solution.
Yep, absolutely.
I really wanted to thank you for joining us today. You bring so much experience to the table, and caregivers are listening astutely. They have lots of questions. They have lots of things that need to be sorted out. They need change, as you well point out. We're now seeing in Canada and the States, some movement towards recognizing the huge costs that are borne on the shoulders of caregivers. Costs with the system without really checking in with caregivers, just pass on to them. And we've certainly, with a lot of our guests, heard stories about that. But hopefully now, even in the corporate world, we're coming to recognize that productivity can improve if you actually incorporate flexibility into your employees' schedules to allow them to caregive, to be at appointments, and they'll come back to the work healthier, feeling less stressed, and be able to produce remarkably better.
Yeah, no, I think that's really well said. Really important. Absolutely.
Thanks for your time. We look forward to your future contributions and any future conversations. Thanks for being here today.
Yeah, thanks a lot for having me. It was great speaking with you.
That wraps up this week's episode of the Caregivers Podcast. Thanks for being here, and we will see you next week. Dr. Coleman, thank you for helping us speak to one of the most painful and least understood places caregiving can take a family. I think one of the clearest reminders from this conversation is that estrangement does not erase history, pain, or obligation. It makes every decision more complicated when illness, decline, and time enter the picture. For anyone listening who is carrying this kind of family conflict, I hope this conversation gave you language, perspective, and a little bit more room to think clearly about what you can and cannot live with later. And if this episode meant something to you, please take a moment to rate the Caregivers Podcast on Apple Podcasts, Spotify, or wherever you listen. Leave us a comment. It really helps other people find the show. Before we wrap up, I wanted to remind you of something important. The conversations you hear on this podcast are here to inform, to support, to spark reflection. They're not a substitute for professional medical advice, care, therapy, or crisis services. Listening to this podcast does not create a doctor-patient or caregiver-client relationship between us. If you're facing a medical concern, health challenge, a mental health challenge, or a caregiving situation that needs guidance, I encourage you to reach out to a qualified professional who knows your story. If you're ever in crisis, please don't wait. Call your local emergency number or recognize personalized crisis hotline right away. You deserve real-time help and support. The views you hear on this show, whether from me or my guests, are our own. They don't necessarily reflect any organizations we work with or are part of or have worked with or been part of in the past. This podcast is an independent production. It's not tied to any hospital, university, or healthcare system. Thank you for being here, for listening, and most of all, for taking the time to care for yourself while you continue to care for others. I look forward to hearing from you.